everyone! Welcome back to Face It with Dr. G. I'm Dr. G, and I'm so excited to be here to talk to you guys again today. So, and a side note, if you guys are in Mashpee Commons on the Cape, you have to come say hi. We opened our new G-Face storefront and medical aesthetic practice last week, and it's so exciting. We love seeing all of familiar and new faces, so come by and say hi. And today, we are going to talk about the prevention and treatment of skin cancers with treatments that are not topical, such as lasers. So we're specifically going to talk about non-melanoma skin cancers, and these are things like squamous cell carcinomas and basal cell carcinomas. And 1 in every 5 people is going to develop a non-melanoma skincare in their lifetime, and that's a lot of people. And we typically have believed that we prevent actinic keratoses, which are the precancers, using topical remedies and topical treatments like 5-fluorouracil, and we have had great success with that. But we're now finding that there's other ways to treat them, and one of those specifically that I want to focus on, because we offer this treatment in our office, is a fractional non-ablative laser. And there has been research done actually out of Massachusetts General Hospital, and this is why I'm relaying this to you, because it's relatively new and I'm learning about it myself. It's really fascinating, so I wanted to pass it on to you guys. And what we're finding is that these lasers, these fractional non-ablative lasers, meaning they don't completely strip us of our epidermis or completely destroy the epidermis, which is what an ablative laser does. These lasers have actually been shown to treat and prevent not only squamous cell carcinomas, which when we're treating actinic keratoses, we're specifically then preventing the squamous cell carcinomas alone, but we're finding that the laser is actually preventative for both basal cell carcinoma and squamous cell carcinoma. And I think this is important because we typically use these lasers for resurfacing, for gentle pigment correction, for pore size and redness, those broken blood vessels. But now we're finding that this is actually treating these skin cancers. And what I found was really interesting is that it's the mechanism of action. So you guys know I'm a dermatopathologist. I want to know why, I want to know how, and then it's really great to understand tidbits of information to pass on to your patients. They think, they want to know these things. They want to be knowledgeable, and it helps them make decisions and trust you as their provider. So the way we're finding this works has to do with insulin-like growth factor. And insulin-like growth factor is a material substance, it's a growth factor that is produced by dermal papillary fibroblasts. So if you remember, when I've talked to you guys about the layers of the skin, you have the epidermis, you have the basement membrane zone, the dermoepidermal junction, and then you have the papillary dermis, which is right up there in between the reedy ridges of the epidermis, a lot of vasculature there, and then you have the reticular dermis, which is a little bit deeper, and then you have the subcutaneous tissue. So our fibroblasts, both senescent fibroblasts and newer fibroblasts, both they live in the papillary dermis, and here is where they secrete insulin-like growth factor. And fibroblasts typically don't proliferate, but they send signals to our keratinocytes in our epidermis and tell them what to do. And we found that insulin-like growth factor is protective against UV damage. So when a cell in our epidermis, when a keratinocyte is exposed to the sun and UV radiation, it's able to repair because of the presence of insulin-like growth factor. That DNA damage is repaired because of IGF. However, as we get older, we lose the ability to produce IGF, and that could be due to the fact that we have less fibroblasts in our papillary dermis, but in general, we have less IGF. What does that mean? That means our cells are less able to repair themselves after being exposed to the sun and being exposed to UV damage that causes that DNA damage. So you can now just, extrapolate that the older we are, the less ability our cells have to repair, and then they just start to proliferate. And that's when we develop things like actinic keratoses, squamous cell carcinoma in situ, and invasive squamous cell carcinoma. So how does laser play a role? So laser has been shown to actually induce the proliferation of fibroblasts, which by default then will get more IGF and then more protection and reparative capabilities of our keratinocytes, and actually also reduces the senescent fibroblasts, or the dead fibroblasts that we don't want there anymore. So over time and with multiple laser treatments, not only are you getting the benefit cosmetically on the surface of your skin, getting that resurfacing, decreasing redness, decreasing pigment, overall complexion renewal, but we're fortifying our cells, we're increasing the fibroblasts, we're increasing the IGF, and we're increasing our cellular ability to protect ourselves from that overwhelming proliferation that becomes cancerous. So there have been studies demonstrating this, and we have shown that at Mass General specifically, some dermatologists there have shown that cells that are deficient in IGF are proliferative, and they're not able, the keratinocytes specifically, they're not able to stop proliferating. And then if you add IGF to that cellular matrix or to those cells, they stop proliferating and they're more able to repair their DNA damage. So I thought that was super, super interesting. I think it's a way for you to not only cosmetically help your patients in medical aesthetics, but also now you're helping fortify their skin so they're not going to develop these cancers and precancers. And again, as I mentioned, this has not only been shown for squamous cell carcinoma, this has also been shown to prevent basal cell cancers. So your superficial, your nodular, your micronodular, your invasive basal cell carcinomas, which are more common. They're one of the most common non-melanoma skin cancers. They don't necessarily metastasize very often, but they're locally invasive. So if we can prevent them, let's do it. So I hope this helps. This was short and sweet, and there's a bunch of articles out there and new research that demonstrates IGF's capabilities and importance, and now you can relay this to your patients. It'll help them make the decision. Not only are they helping beautify themselves, but they're also treating and preventing, and that's what we want. So hopefully you guys enjoyed this. Tune in next time.